Hello, I'm Madeline Gertler, and I'm the clinical research coordinator for Dr. Mark Norris's Precision Mental Health for Eating Disorder study. We work at the Children's Hospital of Eastern Ontario, which is also known as CHEO, and the CHEO Research Institute. So, establishing effective treatments for eating disorders in adolescents remains challenging, with low overall observed rates of response and remission. The aim of the Precision Mental Health and Eating Disorder study is to explore what and if any biological markers can be used to better inform an individualized approach to evidence-based treatment. So we wanted to document the feasibility of a study that sought to incorporate a collection of biological markers hypothesized to better inform illness trajectory and treatment responses in low-weight adolescents with a restrictive eating disorder. So the objectives of today's presentation are to describe a protocol developed to inform a precision-based approach to eating disorders, to provide feedback on recruitment efforts and success, and lastly, to comment on barriers observed that have impacted enrollment. So now for our participants. So for our study, we're looking at youth aged 11 to 17, and our goal is to have a total of 150 to 160 participants. So as you can see here, we have two groups of participants. So one being eating disorder patients with a restrictive eating disorder. So these are patients being seen at the CHEO eating disorder program. And two, we have controls. So our control sample is also divided into two groups. So one is general controls and the other is siblings. And by siblings, we mean siblings of the eating disorder patients who are enrolled in our study. So for this study, we're also specifically looking at restrictive eating disorders. And so our diagnoses of interest are anorexia nervosa restrictive binge purge subtype, atypical anorexia nervosa restrictive binge purge, avoidant restrictive food intake disorder, also known as ARFID, other specified feeding and eating disorder, and lastly, unspecified feeding and eating disorder. So now for our study design. So eating disorder patients are also separated into two groups based on treatment goal weight. So what is treatment goal weight? It can be defined as the threshold for weight required to help achieve medical and psychological health. So for our study, we have two groups. So those under 90% treatment goal weight and those over 90% treatment goal weight. So if they're under 90% treatment goal weight, they are seen longitudinally for 12 weeks. If they're over 90% treatment goal weight, they are seen only once. So just like controls and siblings. So in this study, we have collected a wide variety of biological markers. So these include sleep, smell, taste, pharmacogenetic tests, a blood sample, and a stool sample. So in addition to these biological markers, we also ask for some psychological measures and a 3-day food record. So now for our recruitment numbers. So overall, it's gone very well with 71% of eligible patients enrolling. And we've had a 96% of patients completing our study. In addition to this, 94% provided a blood sample, whereas 75% provided a stool sample. So there have been some barriers to participation. So for our barriers, we have general barriers to recruitment and some sample-specific ones. So for general barriers, these include stress, distance from hospital, and too busy with school or other activities. So for our study, we do ask for a fasting blood sample, which has to be done in the morning before breakfast. So for some patients, it's very hard traveling far away to come for this sample. And so sample specific, we also have needle phobia. So if patients or participants, potential participants had a needle phobia, they did not want to participate in the blood sample. And in regards to the stool sample, frequently cited reasons for declining participation were disgust and embarrassment. So this feasibility study offers insight into the study design, acceptance, and implementation of precision medicine in a clinical sample of adolescents with an eating disorder. Thank you for watching.